Hello?
Hi, Mr. Andrews. It's Shannon again.
Hi, how are you?
Good, thanks. How are you?
I'm alright.
So you're in a better environment to talk?
Pardon? Yeah, sure.
Okay. So thank you for taking the call. So as I was saying, Mr. Andrews, it's come to my attention that we inadvertently sent documents to you that you should not have received from us. So I want to start by saying that Sorry, go ahead.
No, I'm just coughing because I'm ill.
Okay. My apologies. I want to start by saying that Health Canada takes our responsibility to safeguard personal information quite seriously, and this was something that occurred that should absolutely not have occurred. And the reason I'm calling you is because I have two responsibilities now. One is to work with you to get the information back so that I can contact the individuals who have been impacted by this.
Oh, I already called them.
I would still
Oh,
like
okay, no, but I already told them, so...
Oh.
And I've asked them to call you.
Okay. The other thing that I would like, that it's my obligation to do, is to make sure that this information doesn't remain in the public domain. So I'd like to talk to you about, first of all, I'd like to understand what happened. So perhaps I can start with you telling me what it is that you received from Health Canada.
I received your call page.
And how many pages did you receive?
2.
Were they from two separate calls or just...
Two separate calls and 2 separate people.
Okay. And do you still have the information in your possession?
Yeah, I'm staring at it right now.
Now, if I send you a prepaid envelope, would you please be willing to put those in the envelope and send them back to me?
Sure.
Okay. So we're going to do that right away today. And that will allow us to contact these individuals as well and to work with them.
Okay.
That's really all that I had, but I wanted to know if there was anything else that you wanted to...
Oh, I'm just not surprised that you guys are disorganized. I've been let down from day one with your program, and the fact is, in the past, I had a funny phone call, and I didn't know how that person got my info or that knew that I had a medical marijuana card, somebody from Saskatchewan. So, that didn't, concern me. I thought, well, maybe they were just a friend of a friend joking around. But now that I look at it, I don't know anybody from Saskatchewan, so I always believed in you guys, like when I paid my taxes a long time ago. And now that I'm ill, you guys are causing me an amount of stress that is causing cancer that I can watch it grow day by day. It's gone now, but yeah, you guys need to clean your act up. Your system is very poor, and some of your representatives are misinforming me on several occasions. Every time I call and ask a question, I get a different answer. I was told I could fly in a plane with a pound of marijuana without my card or a piece of paper. All they had to do was call you, and you guys can't give me a clear answer whether or not I can eat cookies with marijuana butter in it or not. And I'm just very disappointed, and this does not surprise me. I've already taken this to the press. I've removed the personal information of the people on there, but I left the areas I took out their birthday and everything else except for the dates and, their addresses I took out, their names I took out, so because, you guys are slack, and that's what I told the reporter. And I've been trying to get them to report my story for a long time because you guys have been wasting my time, and I'm the terminally ill person.
Okay, Mr. Andrews, can I ask a question?
Sure.
Are you telling me that you have already sent...
They contacted you. Your media relations person already has talked to the reporter.
Okay, but have you sent any documents to a reporter?
I sent them a document where the private information was removed. I removed their phone number, their name, their date of birth, their other phone number, whoever's name was with them, or their worker, their address, their postal code. I left the city they were from.
Do you have any other copies of these documents that we originally sent you?
Pardon? No, I have a photograph of them.
Would you be willing to send me back the photograph?
I have a photograph of them in digital format. How do you want me to send you that? Through the email, or?
Well, I'd like to make sure that this isn't in the public domain.
It's not in nothing. Listen, you guys, it's already in the public domain. I am the public.
Right, but I'd like to retrieve it from the public domain.
Oh, okay. Well, retrieve it then. I will remove what I have currently.
Thank you very much. I appreciate that. I appreciate your willingness to cooperate with us on this.
Well, it's not fair how you guys treat your patients. You know, and the fact that you say you record your calls and then when somebody calls you on it, you guys, you need to do a revamp of that because you're killing people. Then you're killing me. So.
Certainly, I don't like to hear that we're letting down our.
My friend, you know how many people I've had to tell them the sneaky ways to make sure you guys don't lose a Health Canada form? To send it 3 different ways and get a signature to ensure you get it? You know how many people's I've done where I've printed out the address, taped it on the envelope, paid for it, sent it myself, and you guys lost it? How many times? More than 100. So, clean your act up, because you guys are ridiculous. You're a clown show. Are you guys using the medical marijuana on your breaks? Because you got to bring back the dose. Because there's something wrong with you. I do a half an ounce a day, as per my card. And I'm not this stupid. I couldn't, you guys think that we're just idiots, and we're not. You treat us like fools. You treat me like public housing treats me. Like a dog that deserves no respect. Because I don't get any respect from you.
That's certainly not my intention, Mr. Andrews.
But you need to go higher with this, my dear. You need to say that this person is very irate and that they had to go to the media and compromise somebody else's public information just to get their point across? Come on, hello. I've been calling you guys for freaking ever and lied to. And got myself in, situations where I could go to jail and catch hepatitis C again. And then I have a policeman call your number, and the person says, "Oh, we'll call back in 3 days." Garbage.
Can I say something?
Sure, I've said my piece. You may have the floor.
The reason that I have Graham and Isabel with me to take notes of this.
Sorry, what was their full name again? Graham and what was his last name? Brown?
Graham and Isabel. That's all you need to know.
Oh, I thought you said their last name prior. I apologize. I was going to say that by their first, but like Mr. and Mrs. Go ahead, sure.
The reason they're here with me is because I can assure you that I've already made people aware who are higher up than me, and I want to make sure that they understand that we've spoken with you, that you're willing to cooperate with us, and that they're aware of what occurred so that they can make sure that we don't repeat this mistake.
Yeah, and your other mistakes. You're lucky that I'm willing to cooperate, because you guys don't cooperate with me. But continue.
I'm very thankful that you're willing to cooperate. And
I'm only doing that to protect the information and the people that are involved. They're thoroughly upset. They are peed off. They do not like you.
And I would very much like to get this information back.
Well, I'm just telling you, they're ready. They got their guns ready to blast you with their words. So I'm giving you a break here because I could definitely just wring your neck over the phone with words. But what does hurting you with words do? Let's see what you can do with actions based on this mistake and the ones that, that I've come to you with this, and you tell me that you're going to call me back. There should have been somebody on the phone immediately yesterday. Immediately. Don't you think?
Mr. Andrews.
Don't you think immediately?
At what point yesterday, though? I'm not sure that I...
I called yesterday at 11 in the morning.
Who did you call?
The number on the back of the Health Canada card.
Did you leave a name and a request?
I talked to somebody. They put me on hold, and then that's how I got you. It was yesterday or the day before, whenever I got the mail. I can't remember because I've been so busy.
I'll make sure that I find out what happened, but I didn't receive that message. Had I received that message and had I known that this had happened, I would have called you immediately.
So what do you do when the police call there? How do you feel that emergency?
What do I do when the police call?
What happens when the police call your number on the back of the card?
Police, we get a callback request, and so
Oh, I see.
Will tell us that a police officer called and would like to be called back.
But what's the turnover time on an emergency like that for a patient that's terminally ill?
We have a very high volume of calls right now, and we have unfortunately not been able to keep up, so it's taking us 5 days to return calls right now.
Well, it could be because some of us have to call 3 times to get the right answer. So, okay, so there, you got to do some work, some homework. I have to do some homework. If you want the info of these people off the pages so you can contact them, I can verbally give you that now. Or would you rather me email you the photograph I took of it for purposes of getting it to you ASAP?
We're going to send you an envelope, like I said, but I would also to take the names from you verbally.
Sure.
Okay.
What about their file number? Would that help? I have that too.
Their names will be fine.
Okay. So here we go. Person number 1 is, well, let me find it.